Premier Doug Ford here in St. Catharines today, very pointed in his response to the idea that supervised consumption sites remain open in the province, including a couple of reports suggesting that at least one site remain open and do better.
This was supposed to be the greatest thing since sliced bread. It's the worst thing that could ever happen to a community to have one of these safe injection sites in their neighborhood.
Premier Ford backing up his government's decision to shut down most supervised drug consumption sites in Ontario, 5 in Toronto, those located within 200 meters of schools and daycares. South Riverdale Community Health Centre being one of them, despite a couple of reports commissioned by the province providing recommendations on how to operate it better. One from Unity Health Toronto, the other from the site's supervisor saying, quote, "Evidence shows that consumption treatment services are a necessary public health service, implemented to save lives and prevent accidental overdose death related to substance use." Instead, Ford says he listened to the public.
We're going to put more money in for these heart hubs that are going to support people the right way, not give them a free place where all the drug dealers live.
The province pledging $378 million for new facilities called heart hubs, which current consumption sites do have the ability to transition to. Questions, however, have been raised about how effective they will be.
They have not done the thinking about will this produce even more suffering. In 2023, over 3,800 people die from drug toxicity. This is about 10 a day. 2024, we hear is a lot more. Picture the disaster that we are creating.
It means a devastating loss of life. People are going to lose their mothers, fathers, brothers, sisters, grandparents, friends. There's likely people using the sites that you wouldn't even know that they are active users. Not having a safe supply or a safe place to use that supply means people are going to go to the streets.
How do people who refuse treatment go about making that transition themselves? How do you get them into programs and services that you want them to get into?
Well, you know something, I just don't believe these safe consumption sites. I've listened to the people in the neighborhoods. I've consulted with them. I've been getting endless phone calls about needles being in the parks, needles being by the schools and by the daycare.
As for those reports, one from Unity Health Toronto made 48 recommendations on how things could stay open and improve, including community consultation and safety and security. Those reports were put together back in February and April. Plenty of time to be considered before the province made its decision. Mark McAllister, City News.